Welcome to Transitioning to Medicare Part 1. My name is Lois Romeo, and I'm from the local SHIP office, which stands for State Health Insurance Assistance Program. We are local help for Medicare. We are no cost, we're confidential, we're unbiased. Everyone that works from the SHIP office is a trained counselor that you would meet with. We can offer you education, such as what we're doing right now. We can do one-on-one counseling. That would be set up by appointment at our office. We can look at benefit program reviews. That could be both reviews of Medicare offerings, as well as if you're trying to compare a retiree plan and what it would look like versus a Medicare offering, we can do that, or how it's coordinated with Medicare. We also can do application assistance. That would normally be for looking at financial assistance of some type, but we can help you with that. We also can do problem resolution. If you've got something that's not working right under Medicare or you don't understand it, we can help you with that. This is available to all Carroll County residents, but it is also available across the nation. So if you have friends who are living in another county, we just include this in the presentation so you would know, be able to help them figure out how to contact their local SHIP office. It is set up by county or region across the country, and it's done that way because things like Medicare Advantage plans may only be offered in that county and not the one next door. People often think of Medicare and pretty much understand that it's health insurance for people over 65. It also is for people under 65 with certain types of disabilities, and that can include at any age with end-stage renal disease. It was originally set up in 1965, and in 2022, 58.6 million people are on Medicare. That number is projected to grow to 80 million by 2030. 10,000 people a day enroll in Medicare. So that's why if you try to call the central number, it can be, take you a while to get in sometimes. The Part D, or prescription drug benefit, did not come into play until 2006. So we're going to start with, how do you enroll for Medicare? You're going to enroll one of two ways. You're either going to enroll through the Social Security Administration or through the Railroad Retirement Board, if you've been, if that's who you worked for. That's your enrollment for Medicare. The administration of Medicare, however, happens through the Centers for Medicare and Medicaid Services. You'll see that as CMS. It can be automatic. So if you're already getting your Social Security check or your railroad retirement benefit, then enrollment in Medicare is automatic. What you'll see happen is that you'll get an initial enrollment period package. That's going to get mailed out 3 months before the month that you turn 65. Or if you've been on disability, it will happen on the 25th month of disability benefits. That will include your Medicare. So as you are approaching these time periods and you see lots of ads and lots of mailers that look something like that Medicare card you see on the presentation, a lot of it you may be able to throw away, but first look to make sure your Medicare card is not in there. We don't want you to throw that away by mistake. If you're not already receiving your Social Security benefits or RRB, then you need to proactively enroll in Medicare. And you can do that one of several ways. You can do that either on site at www.ssa.gov, or you can do it through your local Social Security office, and that's in Westminster. The number we include here is the number you would call to set up an appointment. If you're a retired railroad worker, then you would enroll with RRB, and that's your phone number for the local office. So when do you go about enrolling in Medicare? You're going to hear the term initial enrollment period quite a few times in this presentation. That lasts for 7 months. It's the 3 months before the month you turn 65 through 3 months after the month you turn 65. If you do your enrollment in those 3 months before you turn 65, then your coverage is going to start on the first day of your birthday month. If you do it after that, then your coverage is going to begin on the first of the month following the month you enrolled. And the exception to all that is if your birthday happens to be on the 1st of the month, then you actually get an extra month. It actually kicks in the month before the month you turn 65. There are some other times we'll talk about that you can enroll, but you may pay a penalty if you delay. So what is Medicare all about? What are the parts? Part A is your hospital insurance. That's when you've actually been admitted to the hospital. So it's the hospital care itself. It's if you had to go from there to a skilled nursing facility, such as a rehab center, it's going to cover that under Part A. There is some home health care under Part A, and any hospice care falls under Part A. Part B, you can think of as all other medical, so not prescription, but all other medical insurance besides what was covered under Part A. So that's going to be your doctors, your labs, your x-rays, even things like canes and wheelchairs, et cetera. That's your durable medical equipment. If you go to the ER, if you have chemo, if you have dialysis, all of those, including mental health, are going to be covered under Part B medical insurance. Outpatient surgery would be covered under that. Part D is the one that's the newest part. Like I said, that came in 2006. That's going to be your Medicare prescription drug coverage. And then Part C is actually an alternative way of receiving your Medicare benefits. Those are your Medicare Advantage plans. They will always include Part A and B, and typically include Part D coverage. One of the books you're going to want to become familiar with as you are enrolled in Medicare and start using it is every year the book called Medicare and You will come out. When that comes out, it's going to have a set of pages in it. In 2023, that's pages 30 through 56. That's going to list all of the covered services that Medicare covers. So for instance, some people are surprised that, vision, dental, and hearing, things that are not medically necessary, are not covered under original Medicare. But we'll talk about that more in a minute. You can look on those pages when you see that blue little apple sitting next to it. Those are preventative services. They would like you to get all your preventative services that you should be getting. And those are typically covered at no cost for doctors who accept Medicare assignment. Very much encourage you through Medicare to get your vaccines. And that's your flu, your COVID vaccines. That also includes standard recognized vaccines that are recommended by the Advisory Committee on Immunization. So some of us that are a little older had to pay for the shingles shots, et cetera. Now those are recognized as being recommended, and they are covered under your Medicare. So as you get your Medicare coverage, you can be on the left-hand side of this chart, or you can be on the right-hand side of this chart. Original Medicare, which is what definitely a majority of our folks in Carroll County are under, is going to include Part A, which again is your hospital coverage while you're admitted to the hospital. Part B, medical insurance, your doctors and labs. You can determine if you want to pick up a Medigap, which is a Medicare Supplement insurance. And that would be to pick up some of your co-insurances and deductibles for Part A and B. And then you would pick up Part D, which is your prescription drug coverage. The reason we have a lot of our folks in Carroll County under original Medicare, particularly if they can afford a Medigap, is because it makes it, for a retired person who's on a fixed income, it makes it pretty predictable what your medical costs will be for the year, because you're going to pay a Part B premium. If you have a supplement, you're going to pay a premium for that. And on Part D, we can run a nice program that will tell you for that year what your costs are going to be for your prescription drugs. So can be very consistent on what your medical coverages are. Under original Medicare, you can go to any doctor, any facility who treats Medicare patients, which is most of them. And you also will then decide, do you want a separate vision plan or dental plan to cover your basic things like getting your eyes examined to get your glasses. So that's original Medicare. Medicare Advantage plan is going to look more like what many of you are used to as your employer coverage has been. That's going to be a regionally based plan, and it will have a network of doctors and facilities. It's going to be either an HMO or a PPO. And in an HMO, if you go outside that network of doctors, you do not have coverage. You are going to pay all the costs. If it's a PPO, can go outside that network of doctors and facilities, but you will pay more than if you stay in network. There are some quote advantages for a Medicare Advantage plan. These plans can have the option to have additional coverage for vision, dental, and hearing. They also will have an out-of-pocket limit of what you could spend for that year. So under original Medicare, you don't have that out-of-pocket limit unless you've got a Medigap that's picking up those items. Medicare Advantage plan, there's a set dollar amount. You'll be paying co-insurances, et cetera, up to that amount. But that's your limit of what you'd spend. You may not be sold a Medigap if you are under a Medicare Advantage plan. There are different cost models and different structures of how you get your Medicare. However, both of these will give you the same services covered. So Medicare defines the rules for all of this. Part A and B is administered by Medicare itself, CMS. Medicare Supplement insurance, Part D, and Medicare Advantage plans are all private companies that will do their own pricing, but they are controlled as to what they have to offer. So your first decision is should you be signing up for Part A, or if it automatically came to you, should you keep Part A? It is premium free for most people. So if you or your spouse has worked for 40 quarters and paid into FICA, then you've already paid for your Part A coverage, so it's premium free. If you did not automatically get signed up for Medicare because you already were taking benefits, then you can contact Social Security to sign up. The reason some people will not sign up for Part A is if they have a health savings account. So once you have any part of Medicare, you can no longer contribute to an HSA tax-free once you're enrolled. So you can use the funds that are in there, but some people will decide, I want to keep contributing to an HSA, therefore I'm not going to start my Medicare. Something to be aware of is if you are still working and you go past 65 and you have not signed up for Medicare yet, let's say you're 67. When you do go to sign up for Medicare, it is going to, if you're over the age of more than 6 months past the age of 65, when you've signed up for Medicare, it's going to predate your Medicare coverage date 6 months. So if you're 67, it's going to take you back to 66 and a half for that start date. So the only reason I raise that, if you've delayed signing up and you've still had coverage and all, and still contributing to the HSA account, you want to stop contributing to that 6 months prior to your actual effective date for Medicare. And again, that's only if you're past 65 and a half when you enroll in Medicare. It's a little harder decision as to whether you keep or sign up for Part B. First thing you're going to want to do is you can delay that if you have medical coverage through your active employment, either yours or your spouse's. But you need to check with your HR department to find out how your current coverage works with Medicare. Some employers, depending on certain conditions, are going to require that you sign up for Part A and B when you are first eligible. So that's why you need to make sure you understand your particular situation. There is no penalty on Part B if you enroll within 8 months of losing active employment coverage. If you don't have medical coverage from active employment, then in most cases, you're going to go ahead and enroll in Part B. There are some people that are going to want to look at it a little further. So in our area, we have a fair amount of retired federal employees. There are some retired federal employees that decide they don't need Part B, and they have that choice. Just remember, if and when down the line you did want to pick up Part B, you would pay a premium and higher premium. I'm sorry, you would pay a higher premium and you can pay a penalty for that situation, or you could end up paying for your health care out of pocket. Coverage based on current employment does not include the following. So if you're on COBRA, you're already at retiree coverage versus active employee coverage, VA coverage, or marketplace. None of those count as active employment and current. If you delay your Medicare coverage for any of those reasons and you're not enrolled within that 8-month time frame, then you may be charged a penalty. So how does your insurance work with Medicare? If you have retiree insurance, yours or your spouse's, then Medicare is going to pay first, your retiree insurance is going to pay second. If you're 65 or older and you're covered by a group health plan, if your current employer has more than 20 employees, then your group health plan is going to pay first, and then Medicare will pay second. If you're that same set of conditions, but you're working for an employer that has fewer than 20 employees, then Medicare is going to pay first and your group health would pay second. So again, this is all part of why you need to talk with your benefits folks and make sure you understand your particular company and what applies to you. If you're under 65 and you have a disability and you work for an employer with more than 100 or more employees, then your group health plan is going to pay first and Medicare would pay second. But if they have fewer than 100 employees, Medicare is going to pay first. End-stage renal disease is a unique model. If you have end-stage renal disease and you're eligible for Medicare because of that, while you are covered by a group health plan, then your group health plan is going to pay first for the first 30 months after you became eligible to enroll in Medicare. After that, Medicare will pay first, and then your group health would pay second. If you have Medicaid, Medicare will always pay first and Medicaid will pay second. So now you get to make a decision. Do I want to keep or sign up for Part B? So first thing, again, you need to understand, does your employer coverage require that you have it? If you decide you want to buy a Medigap policy or join a Medicare Advantage plan, or if you're eligible for TRICARE, under all of those conditions, you must have Part B. If you have veterans health care benefits, you are in a little bit of a unique situation. If you decide you only want to use your your veterans health care benefits, then you could choose to not sign up for Part B. The way veterans benefits work with Medicare benefits, they do not back each other up. What happens with this is you either could use your veterans benefits for a given situation, or you could use your Medicare benefits. You can't use both of them for one particular treatment or medicine or any of that. So what some of our veterans do is they will go ahead and sign up for Part B in some cases. But they will, for instance, if they've got a very expensive drug that's covered under their veterans health care benefits for less money, they might do their drugs through veterans health care benefits. So again, they need to look at that and talk it through with the veterans VA folks, as well as for those of us at Medicare. Again, you may pay a penalty if you sign up late or if you don't sign up during your initial enrollment period. So when is it you enroll in Part B? Back to your 7-month initial enrollment period, those 3 months before you turn 65 through the 3 months after. You can do it within 8 months of retiring from active employment. If you do not do it in either of those time frames, then you have to sign up during general enrollment, and that is the first quarter of each year, January 1 through March 31st. If you sign up during that period, your coverage is going to begin on the first month following enrollment, but you're also going to have a late penalty, and that would be 10% of the premium, Part B premium, for each 12 months that you were eligible for Part B and did not have it. So on a monthly basis, if you've got $164.90, let's just make it simple, $170 you're paying each month, that's going to be another $17 you're going to pay for your Part B premium for the rest of your life. So you want to pay attention to these enrollment periods. So if you automatically get your Medicare card, you can keep it and accept Part A and B. It's going to look like just what you see here. It's going to tell you your effective dates. Not sure why that says 3/03/2016, because it's always the first of the month. But on the other hand, if you decide you're still actively employed and you really don't want Part B yet, and there are a couple of reasons we'll talk about as we go forward where you might not want Part B yet, then you follow the instructions that come with your card and you return the card saying you don't want Part B. They will then send you out a new card that just has a Part A effective date. It'll have a blank on Part B. So what are you going to pay out of pocket if you're under original Medicare? So under hospital insurance, again, that's premium free for most people. If you do not qualify through your spouse's employment history, you could take the option of paying for that. It's fairly expensive. Excuse me. If you have Part A and you are admitted to the hospital, if you have no other insurance coverage, then you are going to be responsible for $1,600. After that, you're going to have 60 days of hospitalization coverage. If in a benefit period, you need more than 60 days, you have another 30 days where you would pay a coinsurance of $400 per day. If, again, in that benefit period, you actually needed more than 90 days of hospitalization, you would pay a higher coinsurance, $800 per day. That 91st through 150th day in a benefit period is part of what's called your 60 lifetime reserve days. So those actually get tracked across your lifetime. So let's say, you were in the hospital for more than 90 days in a benefit period this year and used 5-year days. Over the rest of your lifetime, you now have 55 days left of those lifetime reserve days. If you've been admitted to the hospital and for 3 full days, not counting the day you're discharged, and you needed to go to a rehab center, then you will have 20 days of coverage with no coinsurances. After that, you're going to pay $200 per day for the 21st through 100th day. So let's talk about what a benefit period is. The last time you got out of either that hospital or the skilled nursing facility, if more than 60 calendar days have gone by, then you start a new benefit period. What that means to you is, number one, you'd be responsible for the $1,600 again. Number two, your day count, your 60 days of hospitalization coverage starts on day 1 again. And it also means that you have the possibility of more than one benefit period in a calendar year. So, for example, and hopefully you never do this, but if you went into the hospital for 10 days in January and came out and did the same thing in February and the same thing in March, the same thing in April, you're still in the same benefit period, and you've now used 40 days of those 60 days of hospital coverage. You're still in that same benefit period. If, however, you went in for those 10 days in January and came out and did not go back into the hospital until April, you now are starting a new benefit period because more than 60 calendar days have gone by since you were last in that hospital. That says you would again be responsible for the $1,600 and you would start your day count all over again. It doesn't matter that you only used 10 of your 60 days of hospitalization. So that's part A. Part B, your medical insurance. Again, think of it as pretty much everything but in-hospital and prescription drug. That does run on an annual basis. Most people will pay $164.90 per month. That may be income adjusted up, and I will talk about that at the end of the presentation. If you are currently taking Social Security, that will come out of your Social Security before it ever hits your bank account. If, however, you're not yet taking Social Security benefits, then what will happen is you will get a quarterly bill for 3 times that amount. Part B has a deductible. So the first $226 that you spend on labs, x-rays, doctors, et cetera, in a calendar year, you're going to be responsible for, unless you have other coverage that picks that up. After that, Medicare is going to pay 80%. You'll be responsible for 20%. If you go to a doctor or facility that does not accept assignment, what that means is they have not agreed to the Medicare rate. They may charge up to 15% above that Medicare rate. A lot of people avoid any issue on that by asking those questions up front. Do you accept assignment? The doctor's office will be able to tell you that. So to give you an example on this, if you go to someone who accepts assignment and your bill from that doctor is $200 and the Medicare rate is $100, Medicare is going to pay $80. You're responsible for $20. You do not owe that additional amount of the $100. If you go to a doctor or facility that does not accept assignment, it's still going to work off the Medicare rate. So Medicare is still going to pay $80. You're responsible for $20, but you can also be responsible for up to $15 more in that particular example. So let's go back to, we're still on the left-hand side of this chart, original Medicare. As you can see, there's a fair amount of expense you might spend in the year if you had a bad medical year where you're in hospitals a lot or major surgeries, etc. So this is why people consider buying supplemental coverage if they don't have retiree benefits, for instance. So we're going to look now at your Medigaps. So what are they? First off, they are sold by private companies. It's designed to supplement original Medicare. So when we say supplement, that's covering Part A and B deductibles and coinsurances. That's meaning it's supplementing the financials, not giving you additional services that aren't covered by Medicare. Your Medigap policy will only pick up the difference if it's something treated that's covered under Medicare. If it's not covered under Medicare, your Medigap is not going to apply to it either. These are standardized plans. So every plan that you pick that has the same letter has the same coverage, but their costs are going to be different. So first question is, do you even need a Medigap policy? You might have some other secondary or supplemental coverage, such as a former employee, TRICARE, veterans healthcare benefits. If so, you might make the decision you don't need a Medigap. In fact, most people would make that decision in that situation. The other question is, are you better off paying, a monthly fee for a Medigap if you need one, versus the possibility of, going in the hospital and owing the $1,600, et cetera. So these are your Medigap plan types, not to be confused with the parts of Medicare. So if you look down the left-hand side of this chart, you're going to see the things we talked about on the earlier page: the $1,600 deductible at the hospital, the $226 Part B deductible, your coinsurances, etc. If you then go across this chart, the A through N are the letters of Medigap plans that you can pick. A and D are the only plan types available to people under 65 who are on disability. So for most of you, you're going to be picking G through N, one of those plans. The most commonly chosen ones are G and N. If you look at G, where it's got an X in every single row except the Part B coinsurance, that says if you're paying your premium for the Part G, it's going to be the highest of the premiums. It's also going to give you the broadest coverage. It's going to pick up all of those co-insurances and deductibles, except that first 226 you would pay for doctors and labs. If you choose an N, it is going to be less premium than a G. You will notice that again, none of them cover that first 226 Part B deductible. But if you look at the asterisks, we explain it down below. It looks a little more like your employer coverage typically did. You go to the doctor's office or facility, you're going to pay up to $20, whether that's a primary or a specialist. If you go to the emergency room and you're not admitted, you're going to pay up to $50 copay. The other difference is that if you choose to go to someone who does not accept assignment, you would be responsible for that extra 15%. So I'm going to give you an example, and there's a book we'll talk about in a minute that you would want to refer to help you make a decision. Do you want a G, a K, an L, an N? It'll help you walk through all the things you ought to think through. But if you are someone who is on dialysis 3 times a week, and you're paying that $20 every time you go for dialysis, then an N may not be, a good option for you, because that's going to give you an extra $90 every week, right? You'd be better off with a G. But for some people, an N is going to be a great situation. When you're picking a Medigap, you want to think long-term, your long-term needs, thinking in terms of, 30 more years or more, right? So a G high deductible, which is that G with the little asterisk on it, we explained down below also. That has become more popular as more people have 401ks or 403bs, because they have some assets to the side. You can think of G high deductible as more of a catastrophic coverage, meaning that it's going to be an upper limit for what you're going to spend in that year, but you're going to pay a lot lower premium, significantly lower premium. And in a good year where you're not using a lot of medical, you could save a fair amount of money with a G high deductible. In a tough year where you have a whole lot of expenses going on, surgeries, hospitalizations, etc., if you look down below, you would pay that first $226, and in 2023, you would pay any of those co-insurances and deductibles out of pocket up to another $2,700. After that, it looks just like a G. It's going to cover all the rest of your medical expenses. Again, this does not deal with drugs. So an important concept for you to understand is guaranteed issue rights. Guaranteed issue rights gives you the ability to purchase a Medigap without medical underwriting. They cannot ask you medical questions. You have guaranteed issue rights that first 6 months that you are 65 or older and have Part B. This is one of the reasons people will delay Part B picking that up. They don't want to waste their 6 months of guaranteed issue rights. They also don't want to pay the Part B premium if they've got good coverage through their employer, right? It's also would be true the first 6 months when you're under 65 and have a Part B due to a disability or end-stage renal disease. So that's a really important concept. There's another time period you might have 63 days, not 6 months. So that would be after an Advantage plan or active employee group health plan ends. If those end, then you would have 63 days of guaranteed issue rights period to pick up a Medigap. The other thing that's important to know is if in your guaranteed issue right period, not only can they not charge you, ask you about medical questions and therefore charge you more because of medical conditions, but if you want one of these policies, they have to grant it to you. So you are absolutely guaranteed you can get one of these policies. So if you're trying to find the right Medigap policy for you, there are two sources that you can go to online. One is the Medicare.gov site and the other is the MarylandInsurance.gov. So if you go out to those, I would recommend going to the Maryland Insurance site because you can see what policies are available under the Medicare.gov site, but you can see the premiums for them under the MarylandInsurance.gov. So that's your better site if you're trying to compare costs, which normally you'd be doing. The other thing you can do is contact us and we will, you can either stop by and we'll give you a book that's printed out of all the Medigap companies available in Maryland and what their rates are, or we can send it out to you. So now you've talked about your Part A and B. Medigap is designed, as we said, to pick up the financial gaps with original Medicare. Then you have to look at your drug coverage. So Medicare prescription drug coverage, you have to have either Part A or B or both to be able to pick up a drug plan. There is no automatic enrollment in the prescription drug plan. You have to actively enroll yourself. You can delay enrollment with no penalty if you have creditable drug coverage. That just means that that coverage is equal to or better than what you would have under Medicare. When you turn 65, drug plans must notify you to inform you if your drug plan coverage is creditable or not. It is creditable if you have it through one of these offerings. Your employer or Union Health, COBRA, Medicaid, FEHB, Veterans Benefits, CHAMP, VA, TRICARE, Indian Health Services. Those are creditable prescription drug coverages. You do want to keep that letter you would get each year, just in case at some point down the line you need to demonstrate that you had creditable drug coverage, and you want to join a Medicare plan later, Medicare drug plan. So again, when can you enroll in a Part D plan? You can do it during your 7-month initial enrollment period. You can do it each year, and we actually recommend you look at it every year because the plans change and your prescriptions may change. So every year from October 15th through December 7th, which is the yearly open enrollment period, you can look at it. In that situation, if you change your plan, it's going to begin January 1 of the following year. Any other time that you would sign up for a drug plan, it is going to kick in the first of the following month. You can join it some other time. So if you lose your employee or retiree creditable coverage, then you need to join within 63 days to avoid a penalty. So unlike Part B that you had 8 months you could join, you need to do this within 63 days. So you want to do it pretty immediately. Otherwise, you're going to have a late enrollment penalty here, and it's 1% of the base rate. Works out to about 34 cents in 2023 for each month that you didn't have Part D when you were eligible. So that can add up. We had folks who did not enroll when Part D kicked in 2006. In some cases, they would be paying more of a penalty than they'd pay for their premiums. And in some cases, they decide they can't afford it. So, pay attention to your enrollment dates. You don't want to be paying a penalty. So what are you going to pay for your prescription drug plan? You're going to pay a monthly premium. So that if you have a penalty, that's where that will come into play. It's going to be your plan premium. If there is an income adjustment because you make more than certain amounts of money, that will be included in the plan premium. And then you may include that penalty. There is a deductible that would be apply across a year. It could be anywhere from $0 to $505, and that will get applied differently depending on what drugs you're on. So if you're on a tier 1 or 2 drug, it's not going to probably impact you. If you're on more expensive drugs, you could be paying up to that $505 the first time you pick up your drugs that year. So it also then, for the drugs on the plan's formulary, you're going to have a copayment or coinsurance. The nice part is, while this sounds very complex, there is a wonderful system out on the Medicare.gov site where you or we for you or Central Medicare can run your drugs where you pick them up and tell you exactly what your costs are going to be and what would be your lowest cost. There's also been some significant progress, particularly on insulin, where it used to be quite expensive. And now there's a $35 cap on most insulins per month. So that has improved significantly over the last couple of years. Most of you will not deal with what's called the donut hole, but some of you will if you're on very expensive drugs. The cost of those drugs, not what you pay for them, but if you filled your drugs enough times that the total cost is over $4,660 in that year, then you will be responsible to pay 25% of the brand name or generic cost while you're in what's called the donut hole. After you've spent a certain amount more, and it's a little more complex way of getting to that number, you then come into what they call catastrophic coverage. And that in that scenario, you would pay the greater of either 5% of the cost, or for a brand, $10.35, $4.15 for generic. Again, most of you won't deal with this, or many of you will not. We do have people that might go in and out of the donut hole literally in January. And we have many others that might hit it near the end of the year, and so it's there for protection. Even this is changing. And down the line, they hope to make it even better, but that's for your awareness. So when looking at Part D, there's things to consider, and these are all out in that system built in again. It's preferred pharmacies. So different pharmacy chains have negotiated with different drug companies to get better pricing for you. You want to look at the formulary. Are your drugs covered under the formulary? Your lowest cost across everything may have one of your drugs not be on the formulary, and that still might be your best bet. But again, that's why the system is so nice. And that's why you don't want to be trying to investigate this, through your own personal research. You want to use the system. There may be pre-authorizations where your doctor has to contact the plan to get a pre-authorization for that particular drug. Or there may be step therapy. And these, again, all show up in your information from the system on the Medicare.gov site. And step therapy just says they may want you to try a generic prior to the brand. So there are a couple of ways you can do that comparison and that you can enroll in Part D plans. The clearly best way to do it is utilizing the Medicare Plan Finder at www.medicare.gov. Again, you can do that, or you can contact us at the SHIP office and we can do that for you. You may call a plan directly, but you'd be calling 23 different plans and then trying to do your own comparisons. Or you could call Central Medicare and they can run the drug comparison for you. So that October 15th through December 7th each year is open enrollment. Your plans change, your prescriptions change. You do want to look at it every year. It does not mean you'll change every year. It just means you should look at it and make sure you're still on the most cost-effective plan for yourself. You want to review your Part D prescription drug plan every year, and you want to compare your Medicare Advantage plan every year. If you change, the new plans will become effective January 1. If you do not change in open enrollment, they will just continue whatever plans you had. So again, that's original Medicare. The one comment I will make, the reason we don't say to look at your Medigap every year is because that's a little longer term decision. And for many people, that's a lifetime decision. You can apply anytime in your life later to change Medigap policies. However, you will not have guaranteed issue rights. So what that means is you will get asked medical questions and they do not have to offer you a policy. So you would not want to give up a policy you have unless you have a new one in hand. So that's why we don't say, look at that every single year. Okay, so let's flip to the right-hand side of this chart. So Medicare Advantage plans, again, regionally based, and we'll talk about the specifics. So who can join a, should you decide you want to join a Medicare Advantage plan? Well, again, just like on original Medicare, you have to have both Part A and Part B to be able to join. You still will pay your Part B premium plus another monthly plan premium in most cases. You may be required to use a network or obtain a referral to see a specialist. You'll have co-pays and co-insurances in most cases that will apply. It may include benefits that are not covered under original Medicare, such as dental, vision, and hearing aid. If you do join a Medicare Advantage plan, you can't use and you can't be sold a Medigap. These are the Medicare Advantage plans in 2023 that are offered in Carroll County. As you will see, a great majority of them are HMOs. And then we have two companies, Johns Hopkins and Humana, that offer PPOs. If you look down below, those plans are only available to people who are QIMBY beneficiaries or full benefit dual eligible. That would be folks who are around the Medicaid financial level. So when are you able to enroll in an MA plan? You can do it again during your 7-month initial enrollment period. You can change it if you want every year. And again, at least review it. October 15th through December 7th each year, with coverage beginning the following January. And there can be some special enrollment periods as well. We will spend more time in Part 2. Part 2 is going to be focused on, won't be looking at enrollment or Part D or any of that. It's going to be specifically looking at Medigaps versus Medicare Advantage plans. So that's where we'll spend our time covering that. This is a chart you may want to look at before you listen to or come to Part 2. It just gives you a high-level summary of some of the things of original Medicare on the left-hand side or Medicare Advantage on the right-hand side. So again, it's more for your information. Once you have your Medicare, many of you already have a Social Security. You've set up an account for yourself out there because you've wanted to review certain things. Once you have your Medicare number, it is highly advantageous to you to set up a My Medicare account. Two distinct systems. The one is Social Security, not to be confused with the Medicare.gov site and your Medicare account. So if you set that up, it's very easy to do. You'll see a screen that pops up like this on Medicare.gov, and you see the left-hand corner, it's going to tell you how to create it. There's even a tutorial you can do out there. Very easy to set up. Once you have it set up, it gives you the ability to look at all of these different things. So that's where you can run your drug comparison, for instance. Once you've put in your drugs, it's saved all that. So the next year, if you're trying to compare, all you have to do is update it, or update that you go to a different drugstore, for instance. It's also where you can view your Medicare claims and the Medicare summary notices. You can even print out your Medicare card if for some reason you can't figure out where you've put it, kind of thing. So it also will show exactly what plan you're in. So it's just a really helpful site to have. It saves your information. It's easy access. Even if some folks are not as comfortable with the computer, they very often will have a son or daughter or relative set it up for them. And if you come in to see us, we will set it up for you, because that way we can pull up that information for you anytime you come to see us. The other thing you can do out there is choose, if you're like me, I feel like I have way too much paperwork anyway. I don't really want to get my Medicare summary notices and have all that extra paper that I have to store and decide when to shred. And, all of the above. So I actually get all that electronically and look at it on my computer. Totally personal choice, though. You can decide what you want to do. So I told you earlier, there are some financial assistance plans. They're called Medicare Savings Programs. If you look down the left-hand side, and by the way, the reason this says 2022 still on this chart versus 2023 is because any new income limits or asset tests, either one, that would come out with new numbers don't come out until later in 2023. Then we will update this chart to reflect that. So if you look down the left-hand side of this chart, you're going to see 4 different programs. The first 3 are federal programs. So the numbers and all would be, and conditions would be true across the country. If you'll notice that each of those has both an income limit and an asset test. Quimby and SLIMB are designed to help pick up the costs, the co-insurances, et cetera, of original Medicare Part A or B, and they would also apply if you're under the Medicare Advantage plans. So Quimby would be pretty equivalent to Medicaid, not all the same benefits, but financially fairly equivalent. It's going to cover your Part A and B premiums and other cost sharing like your deductibles and co-insurances. If you have a little bit more income, you'll notice, not a lot, but a bit more, then you're going to be SLIMB eligible conceivably, and that would pay just your Part B premium. You'd still be responsible for the co-insurances and deductibles. If you are eligible for Quimby or SLIMB, then you're automatically eligible for extra help, and that's designed to help you on the prescription drug side. You'll also notice that you might be eligible for extra help even if you're not eligible for Quimby or SLIMB. It's got a higher asset test, and it's also got a higher income limit. We have a lot of people in the fourth category, Senior Prescription Drug Assistance Plan. So that program, you will see, has a much higher income limit compared to the first 3. And it also does not have an asset test. So if you have 401ks or 403bs, and you're not penalized because you've put some money aside, right? That one, each of you individually, if you're a couple, first off, any of these programs, you would each individually apply for, and we can help you with that. But for each of you, if you qualify, then you would have $60, up to $60 towards your monthly drug premium. So that, that could be $120 for a couple, right? So if your drug premium is $30, it's going to pay $30. If it's $70, it's going to pay $60 of it. And then you get 1 extra switch a year. So normally when you sign up for your drug plan in a year, you do not have the capability of changing that during the year unless certain conditions apply. If you are eligible for SpeedApp, you could change once during that year if you, for instance, got an expensive drug that's not on your formulary. So that's another advantage to that. Folks who are eligible for Quimby and SLIMB and extra help can change up to once a quarter, so they could change during the year. In addition to being the SHIP office, we are also the Senior Medicare Patrol, and that's trying to prevent Medicare fraud. It's estimated Medicare loses $60 billion a year to fraud, errors, and abuse. This program is designed to help detect that, prevent it, and report it. You are the first line of defense for this. You need to protect your Medicare card. Treat it just like you would a credit card. Don't leave it laying around. Don't be giving out your Medicare number, where you shouldn't be giving it out. Watch to see if all of a sudden things start showing up you're not expecting. Be aware, Medicare is not going to call you to sell you something or to visit you to sell you something. That does not happen. If somebody is saying that and they want your Medicare number to be able to see what you're eligible for, hang up on them. The only people you should be talking to would be whoever is providing your coverage already. You don't want to give out your Medicare number other than to your providers. So your doctor and other Medicare providers And or if you call Central Medicare or you come to see us, we will ask for your Medicare number. And that's because it's the only way we can look you up and help you. So the next step is really to make sure you look at those Medicare summary notices. That's what's saying the services that Medicare has paid for on your behalf. So look for things like, do you see things on there you didn't receive? Do you see something showing up more than one time? And you go, wait a minute, I only did that once. Or you see things that, don't even know what they are. They didn't get ordered by your doctor. If you see something like that, the first thing you want to do is contact the provider, because it could be as easy as somebody's keyed in a number wrong. If that's not the situation, then you want to gather that information and documentation, and you can contact either Central Medicare or ourselves. Free and confidential service. We'll help figure out what's going on and figure out whether it's something that needs to be investigated. Again, we are the SHIP and SMP office. Kristen Harvey is the one full-time employee in that office. That's her phone number if you want to call for an appointment. You can also contact her via email. She would set up any of the appointments. Everyone else who works with this is a volunteer. We go through that training and we are tested on the training to be able to do your education. It is free local help for people with Medicare. These I'm just showing you because if you make more than a certain income amount, you will pay extra. So your plan premium on the drug plan, if you look down the numbers, you could pay anywhere from you could pay just the plan premium or up to $76.40 more than the plan premium each month. And you would get notified by Social Security when you get your statement each year what they will be taking out for your Part D and your Part B premium. Part B premium if you have income adjustment. This goes back 2 years to your yearly income. And therefore, if you retire and your income drops significantly, you can do an appeal to Social Security on that. So you want to pay attention to that. The Part B premium, instead of paying that $164.90, you could pay up to $560.50 per month. So again, you want to pay attention to this. It's just more, this is for your awareness. A great majority of people are paying that $164.90, but you need to be aware as you're doing your retirement planning or whatever that you might be paying more than that. And then obviously we always have room for questions. So feel free to reach out and set up an appointment with us at the numbers that I listed with Kristen. Thank you for your attention. Part 2 will cover Medigap and Medicare Advantage plans, and hopefully this was useful for you. Thanks.